Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good day to the respected examiners and evaluators. Thank you for listening to my presentation. So today I would like to present regarding the proposal of my master project. So before I start, I would like to introduce myself. My name is Nur Al-Izzah Binti Nazri, and I am from Emosh Batch 22. So for this master project, I've been supervised by Dr. Tuti Haryati, Binti Jasimin. So moving to the next slide. So the presentation outline for today is started from title, continue with introduction, research background, problem statement, research aim and objective, research question, conceptual framework, scope of research, significance of research, limitation of research, literature review, Gantt chart, and also references. So for the title of my master project is The Risk Control of Psychosocial Hazards Among Healthcare Workers in Megaklinik Zahran, Bandar Bangi. So moving to the introduction part, as my study is regarding the healthcare workers, I would like to touch a little bit regarding the healthcare system in Malaysia. So there has been proof that efficiency of healthcare system plays a very significant part in contributions in our country's well-being, economy, development, and also industrialization. And as we know, Malaysia practice and deliver a dual healthcare system which consists of public and private sectors, and both of them play a very significant role in the healthcare delivery system of Malaysia. Narrowing down to the research background related to the master project, in knowing that healthcare facilities play a vital aspect in our life, therefore it needs abundance of effort and a lot of energy. And this involves around 43 million workers around the world, and they are likely to expose to the various health and safety hazards. This also involves biological hazards, chemical hazard, physical hazard, ergonomic hazard, and also psychosocial hazards. Focusing on the hazards of psychosocial under occupational hazards among healthcare workers, there is study regarding the healthcare workers that found that they are suffering from a chronic and high level of occupational stress, which may come from various reasons, and this can affect to one's personal, mental, emotional, cognitive, and also physical health problem if not being treated well. These inconvenient truths regarding psychosocial hazard also bring unintended consequences of it. In real cases, in December 2019, the world is alarmed by the outbreak of coronavirus disease 2019, also known as COVID-19, which has not been settled down until today. And this put healthcare workers, mainly as the frontliners, under high chronic work pressure, which led to several tragedies of healthcare workers committed suicide. And this shows how devastating and how extreme the psychosocial hazard can be. Talking about psychosocial hazard, it really related to the burnout, depression, and also suicide issues. There are studies regarding burnout that found approximately half of all healthcare workers has suffered from burnout in their career, and consequently, very unfortunate that every year more than 400 healthcare workers took their life, probably related to the increasing depression tragedies and also burnout. Moving to the problem statement related to the master project, the background of the problem is psychosocial hazard is always being overlooked or being stigmatized, and there are studies regarding burnout being under-recognized and under-reported problem. This indicates that psychosocial hazard is lack in terms of black and white reported cases, and there are less attention being paid to the health-related issues related to the stress among employees in an organization. And like many other issues related to the mental health, psychosocial hazards are often being misunderstood or being stigmatized. Therefore, the psychosocial risks cannot be analyzed effectively. Besides, psychosocial risk and occupational stress are among the most challenging issues because of its nature that can't be physically seen, but can lead to the significant impact on the health of individuals, job satisfaction, performance, or even to turnover intentions. Focusing on the problem at the workplace, there are no assessment and there are no documented data being collected regarding psychosocial hazard among healthcare workers in Megaklinik Zahran. Therefore, there is no information available for the organization to analyze and to propose the proper intervention in order to eliminate or at least to reduce the potential causal factors. And this failure to recognize and control the source of psychosocial hazard can lead to bigger risks to the extent of loss of life. The next slide is about research aim and research objective. The aim of this research is to develop the hierarchy on psychosocial risks among healthcare workers at Megaklinik Zahran. There are three research objectives. First is to identify and to detail out the psychosocial hazard among healthcare workers at Megaklinik Zahran. Second is to evaluate in the mean of to assess and to measure the psychosocial risk in terms of likelihood of an occurrence and also the severity of hazard. Third is to propose the risk control of psychosocial hazard by developing the hierarchy as the effective tools to eliminate or at least to reduce the psychosocial risk at the workplace in order to promote and improvise behavior which eventually will achieve safe and healthy culture. Moving to the research question. Question is related to the research objective. For the first research objective, in order to identify the psychosocial hazard, there is need to know what is the definition of the psychosocial hazard and how to categorize the psychosocial hazard. Second research objective is to evaluate the psychosocial risk. Therefore, there is need to know what is the top resources and what is the top risk type of psychosocial hazard, and also what is the score for risk metric of psychosocial hazard and the psychosocial risk. Third research objective is to propose the hierarchy. In order to propose the hierarchy, there is need to know on how to propose and to develop the hierarchy, and also how to evaluate the risk control that has been implemented on the psychosocial hazard. There are several instruments that will be used, including literature review, document review, discussion regarding journal, article, incident report, and clinical SOP review, and also there is need for discussion and interview on personal record and also observation, and also need to use the hierarchy form in order to know the risk metric. And the data will be analyzed by using the qualitative method. Moving to the next slide regarding the conceptual framework. The conceptual framework will be divided into three stages according to the hierarchy term itself. First is the HI, hazard identification. Second is the risk assessment, RA. Third is the risk control, RC. For the hazard identification, focusing on the psychosocial hazard under occupational hazard, there are 5 hazards that will be identified. First is overwork. Second is tight schedule. Third is interpersonal conflict. Fourth is the demanding patient. Fifth is the violent. All of these hazards will be assessed by using the risk metric table, which will be assessed in terms of its likelihood of an occurrence and also measure its severity of hazard. In order to know the level of hazard of each hazard, either it is high level of hazard, medium level of hazard, or low level of hazard. And for the final stage is to suggest the risk control that is proper and suitable for each hazard by following the hierarchy of control, starting from the elimination, following with substitution, engineering control, administrative control, and also the personal protective equipment, PPE. And all these factors will contribute in developing the hierarchy in terms of psychosocial hazard among healthcare workers at Megaklinik Zahran, Bandar Bangi. Moving to the scope of research, the research is focused on the 3 items, which is first is focusing on the psychological and behavioral aspect. Second is focusing on the healthcare workers in private sector industry. Third is focusing on the psychosocial hazard and the risk related to the work. For the limitation of the research is limited to the 50 workers, and it's limited among healthcare workers in private sector industry, and also it's narrowing on psychosocial hazard. Moving to the significance of this research, this research is significant because majority of the healthcare workers work for more than 8 hours daily, and it is very fundamental for psychosocial environment to be in the state of comfortable and harmless to increase the quality of the health service that will be delivered to the patient. And also It is also significant in order to improve the awareness and knowledge related to the potential risks involving psychosocial hazard, focusing on the healthcare workers. And it's also significant because the data from this study can be used as information or guideline on the psychosocial issues through hierarchy. And it's also hoped to be beneficial to any healthcare institution, specifically private healthcare, in promoting a good practice of OSH in organization. And it also significant because there is less of attention that will be paid regarding psychosocial hazard among healthcare workers. Moving to the literature review. For the first literature review from Stehman on 2019, it found that emergency medicine department is on the 5th most burnout cases department, which left behind the urology, neurology, physical medicine, rehabilitation, and also internal medicine. Second literature review is by Leslie Kane on 2019, which found that healthcare workers committed suicide to show how devastating and how extreme this effect of psychosocial hazard. And there are 44% of physicians reported for feeling burnout during their career. The third literature review is by Okiafo and Alamina in 2018 that found healthcare workers are exposed to various psychosocial hazards in the workplace, and there is need for the work policies targeting at these healthcare workers to be implemented. Fourth literature review is by Di Maria and et al. In 2017, which using a two different intervention focusing on organization-directed intervention and also physician-directed intervention, and this bring out a two different result in terms of reduction in the burnout cases. The fifth literature review is by Mei Yang Lo in 2017, which found that healthcare workers are prone to be involved in workplace illness, injuries, and also accidents. But unfortunately, there is little study that has been done in Malaysia regarding these cases. Sixth literature review is by Hanish in 2016, found that anti-stigma intervention at the workplace can lead to positive in improving employee knowledge and supportive behavior towards people with mental health problems. Seventh literature review is by Mika in 2015, which found that employees who work long hours have a greater risk of getting stroke than those who working extended hours. And the study also suggests to pay more attention for the management of vascular risk factor involving individuals who work for long hours compared to the standard hours workers. And the eighth literature review is by Jani, Albert, and Console in 2014. Even though the findings shows the low quality evidence, but the result of mental and physical relaxation and also the changing work schedules can lead to the positive result in order to reduce the stress. The ninth literature review is by Sandra in 2014. Sadly, the finding is there were many reports of silence and inaction in response to the employee mental health issue, and there is also occupational stress proof among healthcare workers that contribute to the absenteeism, which is significantly more days than workers in other sectors. And this is the Gantt chart. Activities for Master Project 1 starting from November 2020 and following to the February 2021 this year for the MP1 report submission. This is the references used for this master project slide presentation. Any question? Thank you for spending your precious time. Thank you so much.